Cystitis is an inflammatory condition of the bladder. This inflammation can be present with or without an infectious process. Some non-infectious risk factors for cystitis include medications, chemicals such as perfumes or colognes, hygiene sprays, spermicidal jellies, and localized radiation. Cystitis may also be a complication of gynecological cancer, pelvic inflammatory disease, endometriosis, Crohn's disease, diverticulitis, lupus, or tuberculosis. Interstitial cystitis is a chronic inflammation of the entire lower urinary tract, which includes the bladder, urethra, and adjacent pelvic muscles. Affecting females more than males, this is typically related to a genetic or immune dysfunction. Urinary tract infections. It's a broad term used to refer to any infection in the area of the ureters, bladder, or urethra. Urethritis is inflammation of the urethra that can result from infectious and non-infectious conditions. Apart from the distal urethra, the urinary and genitourinary tracts are normally sterile. Bacteriuria is the presence of bacteria in the urine. E. coli and Candida are the most common causative organisms. Colonization. Colonization is when a patient has bacteria present in the urine but has no symptoms of infection. Common risk factors for urinary tract infection: obstruction, renal calculi, renal reflux, diabetes, pH of the urine, sex, age, sexual activity, and recent antibiotic use. Urinary tract infections can be categorized in several ways. A recurrent UTI is an occurrence of 2 or more infections in 6 months or 3 or more infections in 1 year. An uncomplicated UTI means that no anatomic or functional abnormality of the urinary tract or condition that increases the risk for infection or possibility of treatment failure to resolve the infection, such as presence of a multi-drug resistant organism or urologic dysfunction. Some factors that contribute to the diagnosis of a complicated UTI are pregnancy, having a male genitourinary system, obstruction, diabetes, neurogenic bladder, chronic kidney disease, and reduced immunity. Complicated cystitis, or UTI, requires more attention on the part of the patient or caregiver to avoid and/or detect adverse events. Urosepsis is the spread of bacteria from the urinary tract to the bloodstream. Urosepsis has a 10% mortality rate. To prevent urosepsis from a catheter-acquired infection, remember hand hygiene. Insert a catheter only as needed. Use a bladder scanner to show that there's urinary retention. Ensure only trained staff perform the insertion of a catheter. Use sterile technique. Maintain an unobstructed urine flow. Secure the catheter to prevent irritation. Use an antiseptic or antimicrobial to reduce biofilm buildup, and leave the catheter in place only as long as needed. To prevent cystitis and urinary tract infection, drink 2 to 3 liters of liquid daily, unless contraindicated. Maintain your immune health by getting enough sleep and nutrition. Do not delay urination. If you gotta go, then go. Females, wipe front to back and avoid irritating substances, and choose cotton undergarments. Males and females should wash genitalia before intercourse. Physical assessment of the urinary and renal system. Assess the patient for frequency, dysuria, or urgency. Assess the patient for fever, chills, nausea, anything that may indicate an infection. If they have the catheter, assess the catheter. Look for redness or discharge at the insertion site or cloudy urine in the urine container. Have the patient void for a urine examination. Teach them how to perform a clean catch urine. Make sure they are educated with teach-back before they collect their urine sample. Remember to assess vital signs. Look for tachycardia. Look for lowered blood pressure. Also, assess the lower abdomen and palpate the bladder for tenderness.